Project, and it sounds like you've got some exciting initiatives lined up for the future as well. It's now my privilege to introduce our next two speakers. Dr. Aunty Billawarra Lee is a senior Larrakia elder, traditional healer, and author of several books on Indigenous healing and culture. She is Charles Darwin University's Larrakia Academic in Residence and is currently advising Charles Darwin University Menzies on the First Knowledges curriculum of their nascent postgraduate medical program. Joining her today, Dr. Mark D'Souza is an emergency physician and sustainability, climate action and health advocate. His work establishing the Royal Darwin Hospital Campus Greening Project has led him to embark on a PhD that explores the mechanisms connecting biodiversity and health in healthcare settings. Welcome to you both.
Thank you, Sarah. Wonderful. So Aunty Billawarra and I are very honoured to be invited back a third time to give this time a 3-year update on the Healthy Patients Workforce and Environment Initiative at Royal Darwin Hospital, which you see twinkling through the plants in the background on this slide. The H3 project, as we fondly refer to it, began as a grassroots collaboration between hospital staff, Indigenous leaders, and climate scientists to spearhead lagging climate adaptation and mitigation in the top end's only tertiary referral hospital. And our project was launched to provide immediate psychological first aid to a healthcare service that was at breaking point back in 2021. And at that time, staff morale was quite poor due to entrenched overcrowding and staffing shortages, which continue today. We also noticed that frontline staff had become exhausted by the COVID-19 pandemic response, and critical incidents and patient complaints were soaring. We know that Indigenous patients are overrepresented in Australian hospitals, and here at Darwin, they make up more than half of Royal Darwin's inpatients and 8 in 10 of our renal dialysis patients. And for Indigenous Territorians, access to healthcare comes at a price. They're disconnected from country, their family networks, and their place-based spiritual, cultural practices that include the use of bush medicines to this day. And Indigenous patients, we notice, prefer to sit outside the hospital where they can be unconstrained by the built environment of Western healthcare systems. And yet the hospital campus was incredibly and remains incredibly inhospitable. And this is only going to worsen as North Australia's climate predictions unfold. For example, by 2070, if we continue on current emissions pathways, Darwin may well see temperatures over 35 degrees Celsius for 3/4 of the year. The H3 project also accelerated Northern Territory Health's sustainability advocacy, which had begun in 2019. We were also mindful of the worsening biodiversity crisis in Australia, which was being exacerbated by the clearing of adjacent biodiversity corridors to the hospital that were known to support over 270 species of native birds. And that's a number that equals 1/3 of the total number of species that exist in Australia today. Before our project launched, you'd be hard-pressed to find a cool and restorative place to defrag and unwind. And as this image shows of the pathology department's break area at the time, the hospital's infrastructure was rife with urban heat islands and poorly adapted to climate. In response to this grim reality, which I've just outlined, we launched the Royal Darwin Hospital Campus Greening Project, modelled on 4 pillars. They were to create cool, climate-adapted green spaces that would adapt to climate change, improve the well-being of the workforce and our patients, promote Indigenous cultural safety, and increase local biodiversity. We secured sufficient funding to kickstart our planting. We recruited volunteers from the workforce and community, promoted by staff communications and a social media campaign. And a CSIRO scientist called Stephen Cook generously donated his expertise to assist our campus users to map hotspots. We also launched an active mobility campaign to promote cycling to work that would improve well-being and reduce staff transport emissions. And since 2021, our volunteers have installed over 1,200 plantings in 17 zones. And this includes over 157 local native species of plant and half the species of the plants that Aunty Billawarra and her colleagues determined were of Larrakia cultural significance. We now see and hear over 18 species of native bird on campus. And these efforts have been published in our case study, which I'll show you a QR code to later. And the media that surrounded our project and this publication has led to influencing the commission of the Royal Darwin Hospital Landscape Master Plan. The H3 project amplified the work of our Sustainable Healthcare Committee, which we had stacked with senior clinicians, allied health staff and executives so that we could spearhead collaboration within our hospital, across government sectors and Australian sustainability networks. And I remember reaching out to Ramsey and his team back at that time. I'm proud to say that all of our efforts have led to the recruitment of the Northern Territory's first Director for Sustainability Action, and now 2 team members. And I'd like to take this time to personally thank the leadership and hard work of Maya Van Bruggen, Lynette Smart and Jade Tavan for their dedication in drafting Northern Territory Health's first sustainability and climate adaptation strategy, which is due for launch in just over a week's time. I'd also like to acknowledge the work of Sonia Chanchlani and Ben Dunn from Doctors for the Environment and the University of Melbourne, who've been instrumental in getting our sustainability strategy up and running. So where is our greening project now? I think that's what everybody's after, 3 years on. Well, these images show the daytime surface temperatures on campus, on the campus at Royal Darwin can exceed 55 degrees Celsius, but it's worse if you're a motorist. The surface of your car can exceed 65 degrees Celsius to the touch in full sun. I can only imagine that the internal cabin temperatures would be even more extreme. And our biodiversity corridors now show an average of a 30-degree Celsius reduction in surface temperature. And in the central image, you'll see even this small irrigated acacia reads much cooler than the surrounding ground, which demonstrates the cooling benefits of nature-based climate solutions. And they're using irrigation, canopy shade, and evapotranspiration to achieve that cooling effect. And the right-hand image shows a now well-used footpath that was ground zero for our planting efforts. And the thriving green spaces that you see in this in the top image increases the thermal comfort of the area and engagement in active mobility, which is great for health while reducing transport emissions. Our project is increasing food and habitat for native fauna, which combats the harm of urban sprawl. Fauna encounters have been shown to improve the quality of nature experiences. They make us feel happier, and they encourage us to think about a reciprocal nurturing relationship with nature. The Royal Darwin Hospital Campus Greening Project is creating restorative, climate-adapted spaces like this, where staff and patients can take a break from the hardship of delivering and receiving hospital-based care. Studies have shown that even 5 to 20 minutes of exposure can reduce stress in our patients and their post-surgical recovery time and their need for analgesia. In the staff realm, other studies are showing that staff members are more productive and that they actually are basing their employment decisions on being able to access green spaces like this at work. And I think this is instrumental in planning for workforce stability in a warming climate throughout Australia. The project is particularly important for Indigenous patients for whom connectedness to nature lies at the core of Indigenous culture and their social and emotional well-being. And we believe our project's emphasis on plants of Indigenous cultural significance promotes cultural safety. And in time, we hope to demonstrate through research that this improves hospital health outcomes for our priority Indigenous patients. And on that, I'd like to ask Auntie B to share a few words.
Good afternoon, everyone. It's really good to be here with you. Our role as Larrakia elders or Larrakia people is really important because the hospital sits on our country, that we look after people to come here. So by working with Dr. Mark and greening the lands of the hospital, we'll get the word out to the community that want to come here. They've got access to healers. The only healers have permission to go into the surrounding area and get in bush medicine, bush tucker that need to help for two-way healing. Malawan, the ironwood, is fundamentally for a smoking ceremony, and that's a basic must-do for every healing. So I can access other Laraki people can access, but I let the other healers from around the country that can use the ironwood for a smoking to help the community person is a hospital. And it's so good. It's close, it's handy, and have not go out and look for it. So it really helps.
Thanks, Auntie B. And in terms of wellbeing outcomes more broadly, we've only been able to collect informal feedback through our social media and face-to-face and email feedback channels. But overwhelmingly, this is very positive. And staff and patients are saying that the biodiversity corridors make them feel cooler and happier. Some staff are even describing parking furthest away as they can, so they can take the longest walk through the corridors at the start and the end of their shifts. And other people are even saying that these corridors are getting them to engage in more nature-positive encounters in their home and land care efforts, for example. If you'd like to know more about our work, this QR code will take you to our study. And our last slide talks about our next steps. Right now, I'm one of the stakeholders in the engagement group that's supporting the final development of the Royal Darwin Hospital's Landscape Master Plan. And our role after that is to campaign for funding to actually implement this plan and also secure its long-term maintenance by an employed workforce. Auntie Billawarra and fellow Larrakia elders are busy helping the new Charles Darwin medical curriculum to develop its modules in bush medicine and traditional healing knowledge in time for their first intake of 2026. And we're hoping that the native plantings can be incorporated in the workshops. And meanwhile, Flinders Rural and Remote are developing sustainable healthcare and climate adaptation curriculum. Anything you want to say about that?
It's really important. And I get healers from other communities ring me say, it's making the fear and anxiety and pain that people feel having to go to Darwin lessen, because they know they have access to the bush medicine and the healers here. It's really important.
Thank you. And for my part, as was mentioned earlier, I've embarked on a PhD to dive more deeply into the potential well-being and organisational benefits of providing biodiversity, place-based biodiversity in hospitals. Thank you very much.
Manma, thank you.
Thank you, Auntie Billawarra and Mark. Yeah, this project I think is just such a great exemplar, isn't it, of nature-based solutions to climate change, but then how that also contributes to patient safety, patient healing, and cultural safety. So yeah, fantastic to get an update. I'm sure you'll be invited back for future presentations as well. So our fun, sorry.
It's really important because they're passing all this on to the younger generations, both black and white, in the medical system.
Absolutely. Couldn't agree more with you. So our final presenter this session is Renee McBrien.